Well, welcome back, everyone. When it comes to taking charge of your health, establishing care with a primary care provider is one of the smartest moves that you can make, even if you feel perfectly fine. Well, today, we're joined by Dr. Omitowoju. He's a LMHS internal with LMHS Internal Medicine main campus. And he's going to talk about what internal medicine is and why it's important for adult health. So thanks so much for being with us, Doctor.
Yes, good morning. It's a pleasure to be here with you.
Yeah, so let's start with the basics, Doctor. So what is internal medicine and how is it different from other types of primary care?
Okay. Well, internal medicine is a broad discipline that touches on a number of systems, pretty much all the systems of the body. And the physician, like ourselves, we are trained or skilled in identifying and managing various disease states as it pertains to these systems of the body. Now, we do provide comprehensive evaluation in the prevention of disease states, in the treatment and in the diagnostics of these different disease states. Now, one thing that makes us different from the primary care provider is the fact that we deal with a complexity of issues. You know, sometimes people will have different disease states and not even realize that they have those diseases. And you can have a disease that affects one system. You can have the same disease that affects a multitude of systems. At the same time, you may have disease states that affect multiple diseases that affect multiple systems. And our role as the internist is to identify these problems and help to treat or evaluate them in such a way that we help the patient.
Yeah, so why is it important for adults to establish care with an internal medicine provider, even if they don't have any major health concerns?
Yeah, absolutely. The interesting thing is that the human body is quite resilient and has a way of compensating. But the thing is, at some point, that compensation fails. And we end up in situations where the body, we use the term decompensation of that particular situation. It's sort of like the backup battery for your laptop or your computer, where when the main power goes out, the backup battery kicks in. But the backup battery is only designed for a short period of time, and at some point it will fail. So a lot of people walk around with disease states that have not fully manifest, and because the body is compensating very well. A good example, for instance, is something we call impaired fasting glucose, or pre-diabetes, as some people call it. A lot of people walk around with numbers that are high. They are not yet considered diabetic, but their numbers are high in terms of their blood sugar. And so they really don't know that they have these disease states. But when they come to the doctors, people like us, what usually happens is that we're able to identify these issues and we're able to give them the relative, the important advice to help to reverse that process and prevent them from developing the full-blown disease. Hypertension is another one. Most people who have the disease starts off with them not knowing, and they walk around with blood pressures that are high. And some of them find out when eventually they end up with end organ damage, at which point things are pretty serious at that time. So the goal is to try to get in with the internist sooner rather than later so that these issues can be identified and they can be treated on time.
Yeah, you just mentioned getting that appointment and whatnot to get in and be seen. So for someone who's ready to take that step, how can they get started and schedule an appointment with you?
Oh, yes. What they need to do now, we are at Lima Memorial Health System Internal Medicine main campus. The number is 419-229-3362. And I really encourage you, if you don't have a family doctor out there that, you can dial that number and come over and see us, and we will certainly help with your health situation.
All right. Well, Doctor, thank you so much for joining us on the show today. I appreciate it.
You're welcome. Thank you so much.
All right. Well, don't go away because we have more when we return.